Welcome to section 10 of musculoskeletal anatomy. In the last video, we discussed the ligaments and menisci of the knee. In this section, we'll be discussing other knee and leg conditions. Let's get started. This is a table of the other conditions of the knee and leg. Let's begin by discussing prepatellar bursitis. Prepatellar bursitis is inflammation of the bursa, and this is located just anterior to the patella, or the prepatellar bursa. Let's pull up an image so you can see what this looks like. In order to understand the prepatellar bursa, we first need to understand the synovium. This is an anterior image of the knee which highlights the synovium. The synovium, or synovial membrane, is a type of fibrous connective tissue that lines the joint cavity and provides support. The joint cavity contains synovial fluid that lubricates the joint. This is a lateral image of the knee which shows the synovial cavity as well as several bursae. A bursa is a synovial sac that functions by alleviating pressure and friction near bony prominences and ligamentous areas throughout the body. In this image, you can see the suprapatellar bursa, prepatellar bursa, and infrapatellar bursa. So prepatellar bursitis is inflammation of this bursa right here. This occurs due to trauma or from repetitive kneeling. This makes sense, right? If you're constantly kneeling, then the pad just anterior to the knee, or the prepatellar bursa, may become inflamed. A patellar fracture is pretty straightforward. This is a partial or complete break in the patella bone, which occurs due to trauma to the knee. It presents with a decreased ability to extend the knee because the quadriceps tendon is unable to properly transmit force. If we return to this image, we can see that the patella acts as a bridge between the quadriceps tendon and the patellar ligament, which inserts on the tibia. Therefore, an intact patella is necessary for the force of the quadriceps muscle to be properly transmitted to the tibia. This is why a patellar fracture will result in weakness with knee extension. This is a lateral x-ray of the knee. Notice the obvious patellar fracture right here. Iliotibial band syndrome is an overuse injury involving the lateral knee where the iliotibial or IT band crosses the lateral femoral epicondyle. I'll show you an image of this in a second. It occurs due to friction between the IT band and the lateral femoral epicondyle, and it's common in runners. This is an anterior view of the leg. Notice the tensor fascia latae muscle right here. As the muscle continues down the leg, it becomes a fibrous band of connective tissue known as the iliotibial band, or IT band, which you can see right here. The lateral femoral epicondyle is approximately here. So inflammation occurs at this location as the IT band rubs against the lateral femoral epicondyle. Osgood-Schlatter disease, or traction epiphysitis, is an overuse injury involving the anterior knee which presents with progressive knee pain. This occurs due to repetitive strain and avulsion of the tibial tubercle, which is the location of the secondary ossification center due to contraction of the quadriceps muscle. It's common in participants of sports involving running and jumping, as well as adolescents following a rapid growth spurt. If we go back to this image, you can see the tibial tubercle right here. This is the site of the secondary ossification center. Notice that the patellar ligament inserts on the tibial tubercle, so repetitive contraction of the quadriceps femoris can damage the tibial tubercle. Okay, moving on. A popliteal synovial cyst, or Baker's cyst, is an enlargement of the gastrocnemius semimembranosus bursa in the popliteal fossa. I'll show you a picture of this in a second. The etiology is multifactorial and likely beyond the scope of step 1, but briefly, this may occur due to trauma to this region or because of coexisting disease of the joint. It's common in children and adults. This is an image of a popliteal synovial cyst, which you can see right here. Again, this is also known as a Baker's cyst. Notice that it's an enlargement of the bursa between the gastrocnemius and the semimembranosus muscles. You can also see the popliteus muscle right here, so it makes sense that the bursa is in the popliteal fossa. This is an axial MRI of the leg. You can see this enhancement on the posterior aspect of the knee, which is a Baker's cyst. Medial tibial stress syndrome, also known as shin splints, are characterized by diffuse pain along the anterior aspect of the tibia. This occurs because bone resorption outpaces bone formation. It's common in runners. From this image, you can see the tibia or shin bone right here. So diffuse pain occurs all along the anterior aspect of the bone. The last disorder we'll discuss is compartment syndrome. This is characterized by increased pressure within a fascial compartment of a limb that ultimately compromises circulation. There are many causes, including long bone fractures, reperfusion injuries, or animal venom. The exact mechanism of how these cause compartment syndrome is poorly understood, so it's not worthwhile discussing here. It commonly presents with pain out of proportion to findings and pain with passive stretching of the associated muscles. Motor deficits are a late finding and a sign of irreversible damage. Okay, let's review with a question. A 21-year-old male comes to the office due to knee pain which started 2 days ago. He is a missionary for his church and prays on his knees multiple times a day. Physical examination reveals no warmth, swelling, or erythema, but there is tenderness over the anterior aspect of the knee on palpation. Which of the following is the most likely diagnosis? A. Patellar fracture. B. Osgood-Schlatter disease. C. Popliteal synovial cyst. D. Prepatellar bursitis. Or E. Septic arthritis. From the question stem, hopefully you notice that this patient prays on his knees multiple times a day. This exposes the knee to repetitive pressure and can cause inflammation of the bursa. So the correct answer is D, prepatellar bursitis. As the question stem states, this commonly presents with tenderness over the anterior aspect of the knee on palpation, but there is an absence of erythema. A is unlikely because this patient reports no history of trauma. B is unlikely because this is much more likely in an adolescent who recently underwent a rapid growth spurt or someone involved in aggressive sports activities. C is unlikely as this typically presents with pain on the posterior aspect of the leg, not the anterior aspect of the knee. Finally, E is unlikely as he has no warmth or swelling, which is much more common in septic arthritis. So again, the correct answer is D, prepatellar bursitis. From the image, we can see that the prepatellar bursa sits just anterior to the patella, so it can become inflamed with repetitive kneeling.